Stretching our muscles outside their normal range of motion can cause strains and sprains. That's why you should always do warm-ups and stretching exercises before working your body. But if you do pull a muscle, the appropriate first aid can make you feel better and quickly put you on the road to recovery. To minimize swelling, elevate the injured area, resting it on something soft like a rolled-up jacket or a pillow, keeping it above your heart. Be sure not to put any additional strain on it. Apply ice for 30 minutes, then remove it for 15. Repeat this cycle on and off for several hours if possible. A fall or other serious impact can often result in broken or fractured bones. There are two types of fractures: simple and compound. If someone has a simple break, that's one where the bone doesn't come through the skin, call for emergency help immediately. Then try to comfort them. Normally, you don't want to move the victim unless you're sure this won't make the injury worse. If you must move the victim to get them medical help, apply a splint to the break. Use something rigid like a piece of wood or even a folded magazine. For example, if the victim has a broken arm, rest the arm on the splint. Secure the splint by gently wrapping two wide strips of cloth or bandage around the arm, one above the fracture and one below. Tie the ends of the cloth together under the splint, leaving the fractured area uncovered. The splint should be snug but not tight enough to cut off circulation. If the injury is in the forearm, below the elbow, put it in a sling. Other fractures should be treated the same way. Always try to keep the area from moving or shifting. Immobilizing the break will reduce the chances of further injury. And remember, always get the victim to medical professionals as soon as possible. If you're dealing with a compound fracture, that's one with an open wound, don't try to push the bone back under the skin. Instead, use a clean dressing to stop the bleeding. Then treat it the same way you would a simple fracture. Watch yourself around accidents where there's blood. To protect against the possibility of an infectious disease, you should wear latex gloves if possible. If you feel it's unsafe to help the victim, wait for emergency personnel. Injuries that are serious or cause a lot of pain can throw you into shock. This is where your body goes a little crazy trying to treat the injury itself by rerouting the flow of blood to the injured area, which can leave other areas of the body without the blood that they need. If the body goes too far with its emergency response, it can actually kill the person. Wrap something around the victim to keep them from getting chills. Try to calm them down. If they get agitated, the shock could get worse. Stay with them until emergency help arrives.